Let's talk to Dr. Monique Gasper, who is a medical doctor, joins us virtually from the United Kingdom capital, that's London, to talk about the humanitarian situation here, the migrants moving across borders. Dr. Gasper, thank you for your time. Welcome to the program.
Good morning. Thank you very much for having me. Good morning.
Let's look first, of course, at the situation when people whose health status is not particularly tested or sure of cross borders, especially at the time of pandemics, which we are now. What should medical systems in receiving countries be on the lookout for?
Thank you. So this is a very sad time for Ukraine and for Europe as a whole, really. There's always been and there always will be conflicts. It's part of human nature and no doubt a culmination of disagreements. Like you said, how can we mitigate these disasters? War isn't the only humanitarian crisis. We're virtually out of a pandemic now, and we do have to have measures in place. The main problems with this is the people coming from the war zones, the consequences of what they have witnessed and what they have experienced there, as well as their coexisting health problems that they already have at that time. So you have the pre-migration problems and trauma especially, and then when they come into the host countries, you have the problems of post-migration, resettling these people and coping with their war traumas that they've experienced. In terms of the Ukraine war, we know that less than 40% of the Ukrainians have been vaccinated against COVID-19. And so them going out into other countries, as well as being in refugee camps, you can see that this is a big recipe for spread of the virus. We know that we're in another surge with a different mutant, and we know that that's what viruses do. They mutate and different strains will come up. We hope that's not the case, but we can put in place vaccination on arrival as one of the options for Ukrainians that are going to neighboring countries that are fleeing the war in their country. We also know that next to Africa, Ukraine has the highest incidence and prevalence of HIV. And because of access problems of getting antiretroviral medication to them, some of them are not able to get their medication. What does this tell us about what is going to happen with their viral load and what is going to happen with HIV generally? And these people are crossing borders as well. At the moment, their priority is survival, shelter, food and water. But we have to also put into place some of these other aspects of it. Primary care is where we would deal with most of this, and we do need as much as possible to train up professionals that can help to mitigate some of these circumstances from the Ukraine war.
The visuals, I don't know if you can see them on the screen. A lot of the movement across the borders from Ukraine into all these other countries in Europe also involve very small children, you know, babies in many instances, and then infants, younger ones, and all of that. And they also have particular issues that are specific to them. I spoke with a Polish doctor last week, and Poland has received about 2.5 million of these migrants. And he says that some of the problems that they're dealing with are that some of the children in the process of crossing international borders have mixed with other children of, you know, from other families who are also making the crossing. And then you find out that they've caught something or the other. So that puts pressure on the pediatric segment of the healthcare system. Is that something you think recipient countries should also be worried about?
Absolutely, and not just for the pediatric services, for all health facilities. Mental health is a very, very big one at the moment. We're aiming for universal health coverage so that everyone can access the health that they need at the time that they need it. But obviously, this is much harder in the face of any humanitarian crisis, and refugees are at much greater risk of being able to access appropriate health care. There might be a big language barrier. They're traumatized. Some of them are not even speaking because of the atrocities that they've witnessed. They've been separated. Attachments have been broken. They've had to leave their spouses, their brothers, their fathers behind for the reasons that we're aware of. So yes, all the services have to absolutely be put in place. But even amongst the refugee population, we have to have special attention to the at-risk groups. The children will always follow the mothers. So while you're looking at child health, you can't separate it from maternal health. You have to look at the elderly, you have to look at those with disability, you have to look at those with mental health problems, and also you have to look at those in marginalized groups. And it's a massive problem. It's a very joined up problem, and we have to look at it as holistically as possible. And vaccination on arrival is one of the ways, like I mentioned, that we can mitigate against this. Different countries have different vaccination schedules, so it's trying to marry what they've already had with what is available in their host countries. But some of this, if you're running from a war, the last thing you're going to be thinking about is to pick up your vaccination card. Most of them you can see walking with just a rucksack on their back. So it's starting the whole program again to protect them as much as possible.
Before I let you go, I must ask about the situation in the UK. The UK has instituted a scheme to accommodate Ukrainians in the UK. The numbers, of course, are nothing like the 2.5 million I referenced when I was talking about Poland. But in terms of the UK itself, are you seeing any of the things you've described as part of the experience that the UK has had receiving migrants and refugees from this war in Ukraine?
Personally, in general practice, I haven't, and I'm based in London, so I expect that we will see a lot more. But the UK has a scheme where it's Homes for Ukrainians, which social network is extremely important, especially for refugees. That's one of the biggest traumas that they face. And with this Homes for Ukraine, they're directly linked with families and individuals who are able to receive them into family homes, who are able to support them, and so try to break that chain of trauma that they may have experienced. And there is communication between the host family and the refugee. It's by far not enough. We still need to do a lot more, and the speed at which it's happening, but the speed at the migrants' influx is unprecedented in a very short space of time. The number of Ukrainians that have had to flee the country. So it's still a work in progress, but the Homes for Ukraine is, I believe, will be quite successful in mitigating against some of the social disconnect that is likely to happen as a consequence of the war.
Dr. Monique Asper, medical doctor, the visuals, some of them are quite disheartening there. But want to thank you for your time and for your work in this area. We'll be getting back to you, hopefully, on a happier note further down the line as we continue our coverage of this situation. Thank you for your time this morning.
Thank you very much. It's not all entirely bad news. We do have some modern trauma experts and equipment, so at least the Ukrainians are getting some of that. But we do, as much as possible, need to mitigate the negative aspects. Thank you very much.
Thank you very much.